Hi, good afternoon, everybody. I'm Wayne Francis. I'm the founder of Together We Ride. So, Together We Ride, who we are and what we do. So, basically, what we do is we use cycling as a means or a driver to help people promote their health and their well-being. We also have been trying to improve diversity within the cycling space. You know, when you're out there, you notice that it's more swayed to more European people, but there's so much benefits with cycling. What we are trying to do is actually get more black and brown people into that. Okay, so just a little story, so I can give you a backstory of why I started Together We Ride. So during the lockdown, you know, many of us, we kind of had some form of adversity. Mine was health related. You know, I was really stressed out. I wasn't enjoying my job. I was working from home. I had my little one at home as well. And I was trying to homeschool her. I'm not the academic type, you know, and that was stressing me out as well. And as you can see from the picture on the left, I also put on a lot of weight. And it got to a point where all of those factors was just really, really getting me down. So I wanted to find a means of just trying to escape it. I don't think I was looking at my health at the time. You know, we had to be in our homes, but we could get out by ourselves. So I got myself a bike, and through that, I just started to get fitter and fitter in terms of just being able to cycle longer and cycle further. And as time kind of progressed, I just started losing weight. I didn't change my diet at the time. You know, I was taking one step at a time, but I actually went from picture A to picture B very, very quickly. And at the time, it was like, you know what? I know many other people are going through some of the trials and tribulations like myself, and I want to share this. I want to get out there and I want people to get their bike. You know, my saying, if you look at our social media at some point, is get a bike, meet new people, do things, and go to places. And doing that, people are not actually thinking about, oh, they're doing exercise. We're just doing things fun. And I just started to get really, really healthy. And we've grown exponentially now from one member to over 200 members across London. And we're using cycling to actually get that message out there. Okay. So what our current goals are, cycling itself is something that a lot of people are transitioning into. Even, you know, when I'm looking at the infrastructure and how things are changing, you know, it's things are changing to actually increase more cycling. And that's what we want to do. But what we also want to focus on again is looking at those individuals that are not actually out there cycling and give them the skills to get out there, join clubs like TWR or join communities like TWR so they can actually live a healthier lifestyle. You know, one of the things that I like, or since talking to these guys from One Planet, is that there's a way that we can actually align all of our objectives and our priorities because the outcomes are the same. You know, we actually want to have healthier people. And how do we do that? We can't really do that working in silos. You know, before joining this kind of group and linking up with Impact on Urban Health, I actually couldn't break through certain doors. I couldn't have conversations with people because I'm an individual, and sending a random email to a counselor, they're not really going to kind of, you know, really answer. And if they do, it doesn't really go anywhere. But when you're working together, it actually opens up a lot more doors, and collaboration, you know, is the way forward. So this is one of the reasons why that I'm definitely, you know, involved with Impact Urban Health, One Planet. The conversation that I've been having with Gaurav and Puran, they've just helped me immensely. And even coming here today, you know, as much as I'll be nervous talking to people because it's not my kind of scene, I know at the end of the day, we all want to kind of prioritize the health and welfare of the people that we serve. Okay. Now, One Planet, as I said, you know, I went for a demonstration of One Planet, and before going to that demonstration, it's just like, as everybody might see, oh, people are just trying to sell you something. Although I wasn't buying because I don't have the money for it, it was like, okay, I'm going to turn up. But in fact, when I actually sat down in the room, and I believe it was Gaurav that went through what One Planet is, the mind mapping, I was kind of astonished because when I'm trying to look at again what the priorities and outcomes of, say, the Borough Lambeth and Southwark, I have to drill down and read so much information. I'm just like, okay, I can't get it all in. But with these mind maps and being able to see what boroughs are doing, what their agendas are, and how we actually all are trying to do the same things, it's a no-brainer. I just basically see One Planet as a one-stop shop, and it just allows me to collaborate. It allows me to meet, and hopefully it allows me to actually join the dots together. And again, we all are looking at the same outcomes, and to meet you guys and to see if we're able to work together to produce positive outcomes for everybody, high, low, and medium. And that's something that I just want to achieve. But yeah, this is what One Planet has done for me, and this is what the fund that I was able to access through Impact and Urban Health. I was able to build capability for TWR for us to go out in the community, and we do this off our own back, 3 days a week, and ensure that we bring people together socially. They have a healthy lifestyle, and we're actually getting to view our city and surrounding places on our bikes and have longer lasting health outcomes. That's me. Thank you.